Happy 2 days after Halloween. I thought this would be a good time to just kind of review like where we're at, and what's happening, and how do we continue to go forward, and all of that stuff in in coexistence with COVID. So uh, maybe some of you have seen the dashboard. We had 344 new cases in the last 24 hours. Um, you can see basically the age distribution here, really 20 to 29. Um, Really, it's kind of the younger ages, 20 to 50, really. 50 to 59 is a little bit higher, and then 10 to 19. But certainly as we get older, less cases, which is great. Um, we're staying, we've had 84 deaths in the state, so that's still pretty good. When you look I mean, it's not good, but like that has not increased in a significant way. We can see what happened here. We had that little kind of spike in the end of July. We've kind of stabilized off, and then we're going up, and who knows what's going on right here, because are we leveling, or what are we doing right here? And I think that that's the challenge. Um, I wanted to talk a little bit about, this gives us hospitalizations. I'm going to scroll down a little bit. And if you haven't seen this site, this is the Coronavirus Response Alaska DHSS. It's the hub site. And so this is it's a good place to look to see what's happening, kind of all things. There's been 600 and just over 620,000 tests in the last, or since we started here, turnaround averaging 2.8 days, which that's better, but again, that's an average. So that seems to be variable for people as I talk with them. I wanted to talk a little bit about hospital capacity. This came up in a conversation that I had earlier today. And so some of the issue, like you look, we have 79 COVID positive people in the state that are hospitalized right now. And there's 18 people that are, suspected, or sometimes you'll see person under investigation, so PUI. And we can see from a capacity standpoint, when you look at non-ICU beds, ICU beds, ventilator capacity. So we have capacity right now. One of the concerns that's happening, or one of the things that's happening, is it's not so much right now the capacity issue. It really has a lot to do more so with a staffing issue. That's become more of an issue. Like, so do we have enough people to staff this? So we may have plenty of beds, but we may not have nurses or respiratory therapists or people to care for those. So that limits our capacity. So that's something to think about, because I think sometimes people look at this and go, oh, we have tons of capacity. What are we worried about? Everybody just needs to get sick and we need to get over it. And I don't think that that's the case, because this does not reflect staffing. And, clearly if we end up, as time, hospital workers are getting exposed, physicians, nurses. You got to think about janitorial staff in the hospital. We need, so it's such a bigger thing than just do we have the beds and the ventilators available? We do, but we really got to have the right people to manage those. So that's super important to think about. Our hospitalization rate is 9.45%. So that's kind of what we were guessing. Most people don't end up in the hospital, but we don't have a great way to predict exactly who that is. Theoretically, we know, like, maybe older, more comorbidities, but we've seen some of that flux. The epidemiologic curve that we can see here, you can see that we've been pretty flat and we're coming up, and the projection is that we continue to go up. Hard to say, this is a bit flat, but I don't know that we could say with any confidence that, we're hitting the limits. But I think we're definitely seeing numbers go up. We can see the numbers of day, the projection, the numbers of days to doubling these numbers is just under 18 days. So the growth rate is significant at 3.8%. So we're going up, not stabilizing and going down. But time is going to tell, because all we can do is use prediction models, and sometimes those are super helpful and sometimes they're less helpful. Uh, this graph is actually a graphic distribution. I find this pretty helpful to look at. I don't look at it all the time, but I think it's really helpful if you're looking, down here. I'll put it in the middle of the Matsu-Borough. In the last 24 hours, there were 17 more cases in Palmer, 45 more in Wasilla. So a couple in Willow, one in Sutton, and one other. Other must be a smaller community, a couple in Big Lake. So I think in some areas when there's less than 1,000 people, maybe they won't uh, report a specific location. So so that's kind of where we're at right now. People I know are realizing that cases are going up. There's certainly, if we're watching the schools are now all like on medium, and so we've seen the high schools be closed and back opened, and I think it's a matter of observing, really. But really, what I wanted to talk to people again, and then I want to have time for questions, really, is let's talk about, what can we do. I sent an email out yesterday. Clearly, you guys got this because you're here. I had done a talk. This was way back in April, and we talked about kind of self-care questionnaire. We went through all of these different things about stress. And then it was this one was May 14th. We talked, this was about exercise, but we really talked about different things and what we can be doing. So hopefully by now, um, everybody's taking vitamin D. That would be really helpful. Vitamin D is a big one for me. Zinc, really helpful. We know has antiviral properties. Vitamin C, super important. I mean, there's a whole list of things. If somebody were to start getting sick, I mean, clearly, if anybody tests positive, please, um, you know, get in touch with me so that I know what's going on. Call the office, send a message to the portal. Um, certainly there's a place for NAC. Uh, Quercetin can be really helpful. Quercetin works as is what's called a zinc ionophore, and that helps get the zinc that you'd be taking into your cells. So that helps from an antiviral standpoint. And that's one way that the controversial hydroxychloroquine works as well. It's certainly, if you're somebody that's had more inflammation, curcumin can play a big role, as that's a great anti-inflammatory, as would be fish oil. Melatonin can be really helpful as an antioxidant. So you can, sometimes we will dose that even multiple times a day. When you get in higher dosing ranges, generally it will make you tired. It will work differently as an antioxidant. Drinking green tea can help you. Elderberry is good. So some of those same things that we've been doing, these are the things hopefully people are already doing. Um, Certainly getting outside. Seems like the wind is settling a little bit today, but being outside, getting sunshine and fresh air, moving and getting some exercise, making sure we're getting plenty of sleep, trying to mitigate the stress. I mean, and certainly there's plenty of stress, and I anticipate that's going to potentially for some people worsen, as we go into the holiday season, which we're kind of entering. Certainly it changes how we think about family gatherings, and if you get to see your family or friends or continue some of those same traditions. So I appreciate that. That's definitely a challenge for us during this time, for sure. Um, so we talked about talking about a little bit about botanical things you can do. Another thing is thinking about the things you're eating, lots of colors each day, lots of fruits and vegetables, avoiding more sugar, more carbs. I think that will be definitely helpful as well. In terms of treatment, there's actually been a little bit of more research done, and we're doing research. Certainly some of the standard research that we do, it takes time. So when we're in the middle of all of this, you're always weighing the risk benefit ratio of things, and what's working in hospitals, what's not working in hospitals. And it certainly is really uh, there's controversy around it because everybody has a different opinion about things, and that definitely makes things challenging, if you will. So, really doing what we can to support our health right now. Those are the things I think we need to do, is really cover those. Think about the things we can control, and those are things we can control. And so I think that that's most helpful. Um, I would like to see if anybody has questions. Like, I didn't have another whole immune talk put together tonight, because I think more so I want to address what current questions are, what things we can be doing, kind of things like, what if I get exposed? Really, then you're really thinking about hydration, making sure if you've been exposed, making sure you're getting enough sleep, make sure you're eating well, avoid sugar, and chances are, pending your exposure, you may not, like I've seen families where one person has been tested positive and the rest of the family has not. So it's really hard, to know, like, oh, well, are you at risk? And I think it's about being aware, but also uh, not stressing yourself out about it too, and um, making yourself sick is really important. But really continue that vitamin D, vitamin C, zinc. Um, those are really important things. And then pending if there's any specifics, I'll have conversations with people as needed, if that were to become, a question. So I'm curious if anybody has any questions for me tonight, or certainly always shoot me a question through the portal, as well. That's an option. Questions? Is there anything else specifically that anybody wants me to? Cool. Get some chat here. Oh yeah, tests. That's a good question. You know what? I can compile a site. I can compile a list, but really, when we think about testing being available in the Valley, Capstone is doing tests. I think mainly at the Wasilla location. Matsu Health is doing tests over in Wasilla as well. All right. Lee mentions Borough and United Way. So one thing to know, though, I don't know about fees. I would presume the Borough and United Way. Okay, good. That's test sites. So if you were to go to Capstone, you need to call them. I think they give you a time. You can wait in a line for a long time. You are going to be charged for a physician visit. So know that. I don't think they can charge you for the test right now, but you will be charged for a visit. If you otherwise need a test, want a test, and are okay driving, you can go on to Walgreens website. In Anchorage, they're doing testing. You can get a time through them. You can just get a test. You're not paying for a doctor visit. I would presume it would be the same way with the state website. Everybody's got a little bit of criteria as to like, who are we going to test? What day will we test? Do you have to have symptoms? Certainly, if somebody needs, if you're an essential worker and you need a rapid test, they're not going to do that without symptoms. And that's mostly because of the sensitivity of the test. Um, so for if you needed a test, um, you could, and you don't want to pay for a visit, Walgreens, I think, is probably the way to go. Um, and then, you know, if somebody's been exposed in terms of quarantining, that's like a really brilliant question because that seems to be changing. Um, I think, you know, it would depend on your exposure. And I would say, you know, if you have been exposed to somebody, 15 minutes. The latest CDC is guidelines say a cumulative 15 minutes at a distance 6 feet or less. So, so if that were the case, you know, I would probably, I don't think you have to be, I don't think you have to completely quarantine. I'd be mindful of where you're going, like in a limiting sort of mindful way, if that's helpful. Um, just make sure, you know, you certainly we wouldn't want to do any unnecessary exposure to anybody. Keep an eye on things more often than not. Um, Symptoms are developing between 5 and 10 days. So, um, yeah, that's the whole quarantine thing and what to do if you're in exposure. So that's a really good question. And being asked specifically about 30 minutes at 6 feet, um, I think be really mindful of where you're going. I can actually check with Dr. Zink and get back to people on that one, and I'll put that in a follow-up email. Lori, your question about a rapid test to travel. So there is, let me think of the name of it. There are a couple of online uh, testing venues that you can do a home test. I will, you know what, that's another thing I'll look up. There's at least one, there might be two names of a couple of different companies you can order a home test through. They will send it to you. You do the swab, send it back in, and you'll get results. I want to say in a 48-hour turnaround. So I can find those home tests. There's one or two of those that are available, and I want to say, you know, I don't want to say what the cost is. I wanted to say it was around $100 or $150. But for somebody traveling, I know that is a challenge, and in particular to Hawaii, they're kind of like we are. You know, we're a bit isolated and limited in terms of, you know, where what we have available and how many people we have available to take care of people. So that 72 hours makes sense. I don't know if Walgreens, if I don't know if there's any other testing you could rely on, but definitely doing a test that would be a mail order. I can see I had asked about this a while back. Home tests are usually 72 hours. I had asked Dr. Zink about this back in the end of September. So I will, I'll get you some names of a couple of the home tests. But, you know, back to the whole quarantining, 30 minutes at 6 feet with masks, like definitely a risk. Um, and I will clarify with Dr. Zink specifics about isolation and that kind of thing, if that's helpful. Any Any other questions? And certainly I'm okay with somebody wants to unmute and ask a question as well, like totally okay with that. Um, I just felt like we needed it, and I don't know how to do a more open forum to try and get some questions answered. I know like numbers are going up and that's clearly concerning for people, and that makes sense to me. But, you know, again, focusing on what we can do. Lee and I had a nice discussion on Big Cabbage Radio this morning about this as well, talking a little bit and remembering to think about the things that we can do and can control, and you know, also reassuring that, you know, most people are um, really doing pretty well, even if they do contract this. So I think that's a positive, you know, a really positive thing. And over time, I think we have seen, you know, that rate of hospitalization has not been so high, and also um, basically our mortality rate um, has not, you know, continues to stay really low, which is good. Any other questions?
Yes.
Please.
What is, in your opinion, the best supplement, or what can one do with very sudden, intense stress? What's the best booster for the body in these days and times with that, with a, stress, like bam stress?
So I would probably, you know, that I would say vitamin D, vitamin C, probably melatonin. You know, and honestly, as much as one can do to be outside, whether it's prayer, meditation, journaling, those different things to try to mitigate that, you know, and eat, you know, make sure that you're eating good, healthy, you know, food and nourishing. I mentioned like I think Bach Flowers rescue remedy is great as well. Like that can be really helpful, and that's more homeopathic. But I think whatever any of us can do to really kind of mitigate that. I mean, you know, the acute stress is there, but what we want to do is mitigate that long term impact. So I think, does that help?
Yeah, I just didn't, I'm glad you said the long-term effect, because I didn't think about that. I feel like, I'm like quite stressed right this moment, these last few days, but um, I didn't think, oh, okay, how's it going to affect me in the long run? So thank you for your suggestions.
Yeah, I mean, I think really, really focus on self-care, because that's where we can, you know, center and be able to focus and just kind of, you know, also if you can and you have the time and space is to be able to process. So that will help with the stress also. Question about what's been reported for people who have had long-term adverse effects. You know, that is actually something that is coming out more and more. Um, you know, some people have like, I lost my, you know, I've had a few people now that I've worked with who've had people in the practice have COVID. You know, we've been from as simple as, you know, like, man, I kind of had a runny nose for a day or two and now I seem fine. I lost my sense of smell and taste, and that was for 2 days and I'm fine. Um, some with a little bit more respiratory issues, and it's not making always logical sense to me, like from a baseline health standpoint, not always making logical sense. Some of the long-term things that we're seeing though, more long-term fatigue, Some people have had some fibrosis and scarring in their lungs. There was a bunch of press probably a couple months ago when I think mostly around when kids were going back to school, kids, young adults, college, and the NCAA, and they were talking about doing heart echoes, looking at hearts and looking at heart size. And if we're seeing a little bit of um, cardiomyopathy, and that would not be particular, and cardiomyopathy being like an enlarging heart, and that is not a particular COVID thing. Like certainly I have seen at times in my career when somebody just gets a bad virus and they can have that happen. I don't think, that certainly is not the norm, definitely, but it can happen. And I don't know, I have not searched at this point to see statistically, and I don't know that I've seen that anywhere, like statistically, how many people are recovering from COVID and then having these issues. And I think, in my opinion, like so much of this is so hard because the testing is still not precise. When we really think about if you test positive, um, and we don't want you to get another test for a period of time because you could still test positive even though you're not symptomatic and you're not transmitting. So that, to me, that begs the question, and I'm just going to be completely open and honest about that. It begs the question, if we have somebody that's asymptomatic, well, if they test positive, like, did they have the infection? And now they're still positive? Do they have the infection and they're positive? Like, we don't really know. So if you're asymptomatic and you can test positive, and we have somebody who had it, but 2 weeks later, 3 weeks later, maybe 6 or 8 weeks later, they can still test positive, but we don't think that they're transmitting that point. Like, to me, it just really questions, it raises more questions for me about all of it. Like, how do we know? We don't have a way to know time point, oh, you're infectious right now, or you're not, other than when it's symptoms. Because when we talk about people going back to work, we talk about all that. Like, they're talking about quarantining, for 10 or 14 days, pending from, symptoms. And then if you get a positive test, like I can give you an example. I knew somebody that was exposed on Thursday. A bunch of people were exposed on Thursday, told to pretty much isolate themselves, no symptoms for anybody else. Um, got tested 8 days later. So the following Friday, negative. Finally get the results, which takes days, but they're all negative. So everybody's like, yeah, you can go back to work. So it's really, we don't have anything exact. And I honestly think, the CDC is changing a little bit. Every state's a little bit different about what the guidelines are. And so I think that it causes a lot of confusion. And unfortunately, I think it's raising a lot of doubts among people. And that was part of a conversation that I had earlier today. That somebody's like, well, everybody's got to get it, right? And I'm like, well, maybe everybody does, but maybe not. And then we have this idea of like, well, we have all this capacity at our hospital. And I'm like, well, we may have bed capacity, but we don't know day to day what do we have for employees to take care of the people in the hospital capacity. So it's just a challenge. And I think that there's, because we have, different mandates, it seems, for people coming into the state versus us coming home into the state, different like guidelines out there about how long you need to be isolating versus, full on quarantining. There's a lot of variability and recommendations out there. And I think that really makes things even more challenging. And I will I'll reach out to Dr. Zink and see if I can get a better grasp. especially on this exposure question, because I think that the likelihood of that is increasing for sure. How common is it to get COVID-19 a second or third time? Um, I don't think it's super common. But I think, I mean, there definitely have been cases. The question begs, though, um, are we picking up dead virus in somebody, or is it another infection? And I think that's challenging to figure out, because we're doing this PCR amplification test, so that if there's anything there and we amplify, now we can get a positive. It depends where we put that threshold of the positive. So I think it's really hard to say, and clearly there are a few people, I mean, there's a little bit of, some people have just had an upper respiratory thing right now. And I had somebody say, in a physician forum that I'm in, well, if you're following all the guidelines for COVID, how can you possibly get an infection? And my reply, and this was to a physician, I was like, well, it's really easy to, you know, knock your immune system out of balance. Like, you could not get enough sleep, you could eat crappy, you could get dehydrated, you could be overstressed. So I was like, so what do you mean? Like if we all wear a mask, we should never get sick? Like, I don't think that's realistic either. So hopefully that helps that answer a little bit.
On that same topic, as to whether a person could get reinfected time and time again, I'm not trying to pin you down, but I'm just thinking out loud. If, okay, so this is a virus, and it's known that viruses lie dormant within us. So any little bit of stress could just be causing that to resurface over and over, couldn't it?
I think that is plausible. I don't think we know yet. I totally, as you know, appreciate thinking out loud. You've all heard me do that um, pretty often, and that's okay, because I mean, I think it needs to be a conversation, and yeah, potentially. I mean, we certainly know we have HSV, Epstein-Barr, HPV, like a lot of those things, CMV, cytomegalovirus, hepatitis, like different things can resurface. So I don't think we're not going to ever have probably a solid answer on that one. But I think it is quite possible that we could, for sure, be. Yeah, I mean, you could stay home and stay by yourself and in a bubble, and you could still get sick in theory if your immune system gets overstressed. Any other questions? Comments? Any specific topics that anybody'd like to hear about in the next few times that we meet before the end of the year? Nothing. Okay. I hope that this is helpful. Um, if you have other questions, please feel free to send a message, and let's all just support our immune systems and stay well. Okay. But I hope everybody has a great night. Thank you.